Hello everyone, welcome to our Mother's Health podcast. Today I'll be talking about why is disrespect still happening in maternal world in Nigeria. I was recently sent a video and I'm going to give you a moment to watch this video, and it shows the level of disrespect women face while giving birth in many countries, but this is particularly in Nigeria. So I'm asking the question, why are nurses and midwives hostile to women giving birth in Nigeria? I'm your host and Dr. Viviane Chinwah. Before I dive into the issue of disrespect in maternal world, I'll give you an opportunity to listen to the video I've been sent. So I'm just going to play the video for a few minutes. So just listen.
Keep your hand well. I'm watching you. Fix it well. How much your own? Have a lot of help.
Make everybody help himself to maintain. People where they help you, no go die for your body. Na human being, blood no, na blood they run. Make everybody cooperate.
This video, I'm having mixed feelings, really mixed feelings. First, my heart goes out to the women in this situation that they have to go through this. Some women are being abused. Some women are being mocked. Some go as far as hitting women during labor. And I have mixed feelings. I feel sympathy towards the women, and I also feel sympathy towards the staff, because I'm just trying to get my head around, how do we get to this when people, midwives, nurses, come to the point where they lack the basic compassion, which is a requirement in their ethical standard? When we get this low, that you see a woman in pain, you see a woman physically frustrated, going through such an unbearable pain. The pain of labor is something you can never explain until you have that experience. And women are going through this pain, and you get to the point where you do not have the sympathy and emotion, to be empathic towards these women. And that's what really touched me. What has happened in the system? What has happened in our culture that has gotten us to this point in life where we have no more sympathy? I get it, because a lot of nurses, a lot of doctors and midwives are working under immense pressure on their health. They are going through staff shortages. They're going through poor payment system. And maybe they are also going through abuses from also women and their family members. I don't understand it, how we got to this point where there's a lack of sympathy in our healthcare system. So why does this still happen in 2026? Burnout, long working hours, staff shortage, fatigue, burnout, overcrowded maternity wards. And that's why my heart is so sad, because when you compare that with some of the care we get in advanced countries, and not just advanced, in other countries. I'll get a video and I'll insert the video somewhere here for us to watch. And they also, in the UK, our system is also overburdened currently, but there's still the culture of respect. I'm going to insert a video here if I can find one, to see what the compassionate care should look like. Even in the midst of pressure, even in the midst of burnout, can we have some sympathy towards women? Because what happens is our women are left with trauma after childbirth. And childbirth becomes a thing of fear, and it's not something people look forward to anymore because of the past experience they've had. They rather go to a traditional place where they feel they might have less violence towards them. And let's talk about young girls. When young girls get pregnant and giving birth, it's a story for another day. They are being abused, they are being talked down on, they're being asked, how do you get there? Even though they think those questions are valid, is there an appropriate time that these things can be spoken about? Is there a way that we can show more compassion? There's also the culture of endurance. Also, Women are expected to be strong in this region. So if a woman is shouting out for help, like we saw in that video, they are asked to be strong. They're asked to just pull through, help yourself, because we are expected also be strong and expected to be super women technically. But the pain that we go through during childbirth, and one woman differ from another woman, and it's something that you can't even imagine, and we expect a level of tolerance and patience and care and just sensitivity towards our care as much as possible. Now, what does respectful care look like, and how can we make our care respectful? Now, regardless of the system, is there a way we can speak to each other? At least these women are there in practice, in your care. Is there a way we can change the culture of violence and hostility towards these women? So what does respectful care look like? Respectful care looks like listening to women, and it looks like compassion. What can I do for you? You're doing well done. That's what I got when I'm having my children. You're doing well. One more push. You're almost there. Can this happen in our setting? And I'm just thinking, can it be possible? Can we change the culture of violence towards women? It means asking for consent. It means explaining the symptoms as much as possible. That's what respectful care looks like. It means asking for their preferences. It means being polite. It means speaking respectfully. It means preserving the dignity of women as they are going through their childbirth experience. I know this can be a very difficult ask, considering the kind of society that we find ourselves, the kind of healthcare setting that we find ourselves. It's a very difficult thing because the economy is not that great. People are really going through so much. But what about humanity? What about virtue ethics? What about being kind? What about being patient in the midst of it all? Because causing trauma to people while giving birth is not the way forward. I believe that we can hold two truths. One truth is that our system is under enormous amount of pressure. And the second truth is that our women deserve respectful care. So the conversation is not just about healthcare workers versus women or how bad the healthcare system is. That's not the aim of this video. But the aim of the video is how can we create a system where there's mutual respect, where we can create a culture of care, of humanity, of compassion. I read a whole book on compassionate leadership, and I think training in compassion should be something that is made compulsory for every nurse and every midwife in Nigeria. That training is very important. How do we create that system of compassion, of care? So that is what it's about. How can we provide a safer environment for women to give birth? How can we support our nurses to get all the things that they need? How can we equip our hospitals better? How can we train more care workers to support our women? So these are some of the things that I believe will help to improve the system. Because healthcare workers, they perform better when the system is right. They perform better. When the pay is right, they perform better. When they have all the facilities, when they are working reasonable hours, they will perform better. Because looking back at that video, you can really tell that the whole system is messed up. And the system is not effective, it's not efficient. And it's not just the fault of these women. And it's a general issue. It's something that affects us all. It's something that needs to be looked into. It's something that we need to look at objectively and look at ways to resolve the issue, because women deserve better healthcare experience. Now, in conclusion, respect is fundamental to care. Respect is not luxury, it's fundamental to care. Maternal health is not only about survival, it's about dignity. Women should not be shouted at during labor and during care. Women should not have to leave the hospital traumatized, because this can be prevented. Thank you for joining the conversation. If you have experiences on poor maternal care service or even fantastic maternal care services, Please leave your comment. Let me know what you think about this subject today, the topic of disrespect and shouting on women in healthcare. What can be done? Please let me know in the comment section. Give me your thoughts and your opinions on this matter. I hope you enjoyed the podcast. It's a very short one. I hope we do something better. If you're a midwife, you're a nurse, find it in your heart, even with the complexities involved in our system, and our systems are not what they should be, but we can still cultivate the habit of compassion and care and speaking nicely to people. You remember what our mothers told us? If you have nothing to say, maybe don't say it at all. Maybe if you're pressurized and the system is hard for you, maybe you can talk less. Maybe you can just try to be supportive. Maybe you can just try to give those encouraging words to these women. You can also say, I'll be right back with you. Please give me 5 minutes, give me 10 minutes. I know we are busy today. I'll get back to you in a few minutes. I think you're progressing well. You're doing fantastic. Maybe drink some water. I'll be with you. And that's how they do it here in the UK. It's not like we have all the luxury of time and the system is not pressurized, but there's virtue ethics. And of course, there are consequences if you do that in a civilized society. There are legal actions and you could lose your pin. So things like that has to be enforced in our own system so that people begin to take the responsibility, begin to caution the way they speak and the way they act around women. For the purpose of teaching and correction, I will not be mentioning the name of that hospital in this video, but I'm just using it for teaching and correction purposes. But if you are a midwife, if you are a nurse, and you are tending to a woman today, and you're watching this video, and please be nice to that woman. Childbirth is difficult, as it's painful as it is. So do not add more pressure on these women. Take it easy, I would say, and do your best. With that said, this is Dr. Viviane Chinwah, and this is our Mother's Health Podcast. Please do not forget to share and subscribe to this podcast. I'm on YouTube and on different social media platforms. If you'd like to come on the podcast to share your experiences and to talk about maternal care, I'll be happy to host you. Thank you once again for listening. I hope you're learning something from this podcast today. I hope we can be nice and do our best in our system. Thank you so much all for watching, and have a lovely day.